this, at C5, you could stabilize using the bed rail, right? You could stabilize using a wheelchair that's by the side. Okay, so by stabilizing the distal portion, they may be able to use that muscle to help with functional mobility. You use your yeah. Because I stabilize the distal portion. Can you try to use your brachioradialis and your head momentum to try to sit up? Yeah. Some momentum there, and you're going to rock here a little bit, okay, to bring your arm across. At the same time, you're going to have your head facing that way, and you're going to try to rock and use momentum to help you. You have to be careful with their hand here, okay, because you could potentially just hit him. So you need to make sure that he's a little bit lower, okay, using pec, anterior delt to kind of swing. So now you start to roll towards me a little bit. I could start with him already displaced, okay, and with his leg down, because I'd have to stabilize it. So he's complete. So I could start him already like that to give him a little bit of an advantage. I want to make sure that we are preserving the length of their biceps, because they need to be able to lock the elbow to stabilize them, just like how Kyle is here. See how his hands are in a position like this? No, make a fist so he doesn't stretch out his long finger flexors. So cross your leg and start with your head in this position. Start your hands down here, and then now go ahead. Good. Like if his weight distribution is more up by his shoulders and his chest, then I'm going to have him do it from up here. If his weight was lower, I'd have it from there. Okay. Okay. Partial. We're like here, and he just comes up, and then I would have to help him. Try to pull yourself up. Okay, and as you start to come up, you're going to reach with that hand, and you're trying to push him forward to give him stability. That's going to stretch out his lumbar spine, right? I would have to learn how to swing and go into extension and external rotation to catch myself. I could potentially still be holding on as I'm doing it. And they can do a little bit of depression, a depression type of transfer, a few inches. These are the patients that if you give them like 20 to 30 degrees of elbow flexion to put them at a mechanical advantage, they can lift up and clear their bottom and then use a head-hip relationship to transfer. I could use momentum of my head to help swing to get myself over to pull it out, as well as getting stability in the positions. And it's good weight bearing. And first, you get someone here, you might just have to work on just weight shifting and getting that control. Then we work on doing a slight weight shift. My head starts here, and we may have to use a combination of momentum to help with repositioning. I have to weight shift this way, and then bring the arm over. Say now we slowly work on doing that. Okay, so we're over to here. Next thing is you trying to get this leg. So initially, the therapist may have to position them so that their leg is a little bit more, and then looking at just doing small and getting. Now I'm here. You know, you're stabilizing here to try to move yourself. It's a lot of work in trying to get them up, and then they could use this arm to kind of help. To get to here, you're here. You can lift up to try to get up to here first. Then you're here, try to walk a little bit more. So you're weight shifting on it a little bit more. Then try to how do you gotta have the weight shifted to somewhere else, small amounts of movement, and then using momentum to help substitute for what they don't have. So if they have their pecs, and say they have some of their lats, we need to teach them how to crawl. So they don't have any trunk or leg. So think about like if they fell out of their wheelchair and trying to figure out how they can crawl and move. how hard that would be.